Cimetidine and famotidine are histamine 2 antagonists that decrease stomach acidity. They're both in the top 200 most prescribed medications. The main use of famotidine is in the treatment of peptic ulcer disease and also gastroesophageal reflux disease and in conditions where there's just too much acid in the stomach. This is normally the time that we'd be investigating some of those safety issues associated with those disorders themselves, the disorders that the drug treats. But we've already spoken about some of the safety issues as we got a good picture of the antacids, and we'll discuss them in depth next chapter as we discuss the proton pump inhibitors. So I don't want to double up too much. The proton pump inhibitors are the first-line therapy for those disorders, so it's most appropriate that we speak of them at that time. And while the proton pump inhibitors, like omeprazole, are the most effective medications for reducing stomach acid, famotidine and other histamine 2 receptor blockers do reduce stomach acid fairly well. And that is why it's a good time to try to get some insight into the types of side effects that would be possible when you greatly reduce the stomach acid over a long period of time. Let's review the functions of the acid in the stomach and try to predict the side effects that are possible from reducing that acid. The acid in the stomach probably has more functions than you thought. For instance, the acid begins to degrade many of the foodstuffs. It helps the absorption of some nutrients. It decreases microorganisms. And aside from all that, as we said before, the stomach acid is needed to help the absorption of many of our drugs. So from that, I'd like you to predict some of the side effects that you would expect to be possible as one substantially decreases the stomach acid. We said the acid in the stomach helps absorption of some nutrients. It helps decrease bacteria that are ingested, also helps decrease the proliferation of bacteria in the stomach, and it helps absorption of some drugs. So using that information, I'd like you to make a hypothesis about the side effects that you'd expect to be possible in people taking the histamine 2 receptor blockers. And you'd be correct if you had said that the histamine 2 antagonists or blockers will decrease the absorption of some nutrients, will increase gastrointestinal tract infection risk, and alter the absorption of some drugs. There are at least 3 nutrients that depend on the acidic environment of the gastrointestinal tract, including calcium, magnesium, and vitamin B12. This is really important, especially in respect to vitamin B12 and the elderly individuals. Normally, our ability to absorb vitamin B12 decreases as we age, and deficiencies in vitamin B12 can cause a type of dementia. So monitoring the vitamin B12 levels is suggested if the medication is expected to be administered over months. The other thing about the nutrients affected is the fact that both calcium and magnesium are necessary in bone health. So decreasing stomach acids for long periods of time without supplementing those nutrients can adversely affect bone health. As far as the increase in infections, interestingly enough, the H2 blockers, as well as the proton pump inhibitors, which we'll talk about next chapter, are associated with an increase in GIT infections and also an increase in respiratory tract infections. The absorption of many drugs is also affected by histamine 2 blockers because medications are made for an acidic environment in the stomach. And some side effects that you probably didn't predict include an increased incidence of food allergies, probably because the proteins, the antigens on the food, are not being broken down well enough. And finally, there's a slight risk of developing a faster or altered heartbeat.